Our Geriatrics Workforce Enhancement Program is a project that helps us improve the health and well-being of older adults living in the Kentucky counties of Barron, Bullitt, Hart, Henry, Metcalfe, and Shelby. Since our program's creation, we have formed and maintained numerous collaborative partnerships with primary care providers, area agencies on aging and independent living, and other agencies striving to find ways to help older adults live full and healthy lives. Our team uses a four-prong approach of care coordination, geriatrics workforce education training, grassroots community development, and the creation of Alzheimer's and dementia-friendly communities to achieve this vision of improved health and well-being for older adults. ICOA seeks to educate a workforce to meet the healthcare needs of an older rural population with a variety of challenges. Designed for students, fellows, and residents from medical, nursing, social work, pharmacy, dentistry, and law. Professional healthcare workers and community organizers also join the program as learners. ICOA consists of 5 online didactic modules: critical reflective writing, and in-person case-based learning sessions. The modules address critical geriatric content such as interdisciplinary care coordination, palliative care, motivational interviewing, diabetes, and Alzheimer's disease and related dementias.
My experiences with the online modules were incredibly helpful because I found that it was complemented what I was learning in my classes with care coordination and critical aspects of health of older adults, so issues with dementia and Alzheimer's and cancer and family support systems, and then technical skills with motivational interviewing. So just from a logistical learning standpoint, the online modules were really helpful in my overall education in social work gerontology. And then in terms of the critical reflection, I found those really valuable in respect to bonding with individuals from different backgrounds and disciplines.
I think some administration from the hospital were here, our faculty, some of the attendings. We all participated in actual different characters within the module that we were doing.
I remember the module that addressed hospice care was really informative for me because I haven't worked around a hospice before, about how to support a family that is thinking about hospice and how to frame a conversation in an open way, so they have all the information. That module was specifically useful for me because it filled in gaps that I didn't know.
As a representative of KIPTA, the Area Agency on Aging, I find it really useful to educate students about the Aging Network and what we do in our community and in the state, and then also nationwide, because we exist as a national network.
Our curriculum isn't just for student learners. Members of the existing geriatrics workforce can enhance their knowledge and skills using our curriculum while earning continuing education hours. The Flourish program delivers interdisciplinary, patient-centered care coordination to older adults in our rural areas who have 2 or more chronic conditions.
I'm Brent Wright. I'm the medical director of the T.J. Sampson Family Medicine Center.
My name is James Clements. I'm a third-year family medicine resident here at the clinic.
But we deal with a patient population that's very challenged. You know, we look at patients who are trying to put meals on the table, trying to find work, trying to care for their families, trying to pay for their medications, trying to pay for their health care. When you think about being in the exam room, when you see that the patient has so many social issues and so many areas that need navigation, I need some help. This is beyond what I can do in the remaining 5 minutes, 10 minutes that I have in this appointment. Not this, hey, you've really got a lot of problems. Your life's terrible. I hate it for you. Good luck with that. Here's a referral for someone who may see you in 6 weeks.
I had a patient who was always uncontrolled hypertension. If he was sitting here for an hour or 2, blood pressure was always perfect. But then a lot of times it was just terrible and we couldn't understand why. We saw him walking down the road and it turns out he was walking 11 miles to our clinic one way and then walking home 11 miles. I believe he's in his mid-70s. That's a patient that definitely qualifies. And you saw the conditions that he was living in. You got to full understanding of how he was the caregiver for his wife. I didn't realize that this patient was illiterate until I saw his pill bottles. And you saw that he had a sun or a moon drawn on the bottle, or the number 2 if he was supposed to take it twice a day.
An older adult in need of services can be referred to Flourish by a health provider or community agency. From there, a community health navigator contacts the client, then conducts an in-depth assessment. The community health navigator presents the client's case summary at an interdisciplinary care team meeting, and this team reviews the case and offers recommendations.
It was interesting. The room was full of students and advisors, and with different disciplines, which was really helpful, like pharmacy. And they talked about the assessment process that they go through. It's very, very complete.
Our community health navigator helps implement the recommendations with the client and their providers.
My name is Mary Mae Hensley, and I am a community health navigator, and I assist the clients. I kind of see their problems and their needs firsthand. I'll talk to the doctors for them. I'll assist them in connecting with resources. I'll contact our community organizer, and we'll work together in getting the clients what they need. Well, sometimes it can just be as simple as going into a client's home and maybe they need rails in their bathroom, or maybe they need a hospital bed. And it's hard for the client sometimes to just come out and say, I need a bed. But when we're in their home and we notice these things, we can go back to the doctor.
I am Darla Handy. I'm the community health organizer for Hart, Barron, and Metcalfe County. We work together on just making sure that basic needs are met. I'm the one that kind of goes out into the community and advocates and pulls those resources together to be able to target those specific needs.
I'm Kim Landrum. I'm the RN nurse manager and the care coordinator for the Family Medicine Clinic in Glasgow. We work closely with Darla and Mary Mae in helping coordinate care for our elderly patients. And they come and we talk about different cases, or if we've seen somebody during the week, I'll say, hey, we had Mr. Smith and he needs some help. Can you go see him? And they're like, sure. Because they always see stuff that maybe we don't see. We're looking at them medically and they're looking at them socially.
I think what's important to understand about this model, it's really about the best care for the patient, and there needs to be a lot of good, effective handoffs that take place. I can't take care of patients, in a singular manner. I don't think any physician can. If someone was in your office and they had abdominal pain and you felt like it was an acute abdomen, you would refer them to a surgeon. We don't think of in medicine, hey, someone has social pain, someone has issues that they really need that team. And engaging this team allows you to have that, comprehensive approach.
It keeps that patient out of the ER. So it decreases healthcare dollars. It's better for the patients, and it's better for me. I mean, this is my favorite part of my job. I really get to know these patients and love them. You really understand your patients better.
I got neuropathy bad, I got diabetes, I have asthma, which I had an asthma attack yesterday, and it's scary when you can't breathe. My doctor had me go to these chronic disease classes, and when I got there the first day, Darla was there, and I've learned a lot more.
Because we had no idea that the programs were available to people like my husband and I. And they helped us in so many ways. And the new pharmacy we have, we love those. I could never imagine a pharmacy now delivering our medicine as far out as we live, but they do. They're just super, If something hits my mind, no matter what day of the week it is, and the only way I'm going to be satisfied, I call Megan or Leanne. And if they're busy, I leave them a message. They get back with me before the day is over. So they're great.
When she was having problems, we had to call EMS, and we had to call 3 times in 2 weeks. So we needed to find something around us close that we could depend on. And another thing was we really needed to talk to my mom to find out what she wanted in her last years, days, weeks, or whatever of her life. And so Mona really helped with that, trying to talk to her and figure out what her wants and desires were. Because even, for example, the other night, I was so close to calling EMS because I thought my mom was really on the downswing. And I called Mona, she calmed me back down and she says, okay, what does your mom want? We need to do her wishes. And I calmed down and I said, okay, all right, I'll wait another day and see how she was. And it was best, you know. And I didn't know, I'm not, you know, I don't have any kind of nursing experience, so I didn't know what to do. So the Flourish has been perfect for us.
KCHC is a community-based coalition that seeks to develop the social networks and resources needed to promote geriatrics workforce development in rural communities and to increase the community supports that help older adults lead healthier lives. Our team takes a proactive approach to strengthening the community care plan of the Flourish model of care. Building community resources and networks in rural counties is essential to the long-term success of our clients and communities. KCHC brings together stakeholders to organize activities related to the health of older adults. These meetings are held at 3 locations simultaneously using video communications technology. Memory 360 is our program's initiative to create Alzheimer's and dementia-friendly communities. Memory 360 generates and disseminates Alzheimer's and other dementia-related resources to rural communities. It conducts outreach to local city officials to advocate for the implementation of dementia-friendly communities, working with the police, EMTs, library staff, and chambers of commerce in rural counties to help implement dementia-friendly practices. Memory 360 also offers individual and caregiver support services, such as customized education, counseling, and resource connection for persons facing the challenges of Alzheimer's and other dementias.
He's got Alzheimer's and he's got it bad. One night he was getting out of the bed and I told him to lay down. He said, I can't lay down because I'm going to open the gate and let these cows out. He thought they was in the bed with him and he's turning the sheet back to let the cows out.
Our team conducted 6 focus groups with community members and found stigma to be a recurrent theme when talking about Alzheimer's and related dementias. We decided that the best way to start advocating for dementia-friendly communities was to collaborate with KCHC. In our partnership with KCHC, we conducted a 3-part Train the Trainer educational series for the community and members of the existing geriatrics workforce. The collaboration between Memory 360 and KCHC has enabled us to conduct interactive dementia simulation events in the community and has put the Institute for Sustainable Health and Optimal Aging within the public's reach as a resource to call for seeking help with dementia-related topics.
We have trained many professionals, students, and faculty in infusing geriatrics into primary care, using our online modules, our interactive interprofessional care planning experiences, and our reflective writing exercises. We have 7 different disciplines involved in learning about geriatric care and the role of each discipline. These trainees went back into their primary care settings to provide care coordination to older adults living in rural communities using our Flourish Care Coordination model. Many people in our community have talked very highly about this model, speaking about the value of the model in engaging with older adults to keep them healthy in their communities. All of this we have nested within the development of a very strong supportive community through the Kentucky Coalition for Healthy Communities. This coalition now spread beyond the 6 counties we serve through our collaboration with the primary care practices and the area agencies on aging in our regions. We use a train-the-trainer model to educate the healthcare workforce on how to effectively care for older adults within their communities and clinical settings. We have learned from our community partners how important this geriatric workforce enhancement program is to build capacity in rural underserved areas. This has been a very forceful program in creating an environment of support for our older adults.